Hello everyone, good evening. Okay, I'll be waiting for 2 more minutes till a few people join in. Yeah, good evening. Hello everyone, this is Dr. Sayani Shulamite. I'm a consultant dermatologist practicing at Hyderabad at Capstone Clinic. Today I'm going to talk to you about Maskne, also the mask-induced acne. So, should I wait for another 1 minute probably? Or probably I'll start. Just wait for another 1 minute. Okay, so acne, which is also known as acne vulgaris, it's a skin problem that, just a second, some disturbance is there. Sorry. So it's a skin disease which affects the hair follicles, or it happens when the hair follicles are getting clogged with dead skin cells and the sebum from the skin. So acne can be broadly classified as inflammatory acne or non-inflammatory acne. Non-inflammatory acne is very common. Most of the people usually call them blackheads or whiteheads. Blackheads are actually a plug of sebum in the hair follicle which is darkened by oxidation. So the dark color is not the dirt which you see. It happens because of discoloring effect of the air on the skin color pigment. So the whiteheads are the closed clogged pores that are firm and they appear on the skin. You just see an intact skin, and only when you stretch it you can see sometimes. So what exactly is inflammatory acne? When it can have papules, pustules, nodules and cysts. So papules are small red bumps that feel very sore on touching. Pustules have yellow pus-filled papules with a white tip on top of that. And nodules are large reddish painful lumps under the skin. And cysts are large lumps with pus that look similar to boils on the face, which many would have come across even among the friends. So what are the causes of acne? Now I think everyone knows it's hormonal changes, the menstruation, there is a hereditary role and genetic factors, and apart from that certain medications can aggravate it, along with emotional factors. Emotional stress also can trigger acne. So here we are talking about mask-induced acne. So the times are unprecedented. COVID is something not to be gone very soon. We just wish it's gone very soon. I just hope that we don't have to keep doing this maskne for another few days. So we need to know how, because mask is definitely essential and we need to wear it all the time. So we need to find out the ways how to prevent acne underneath your mask. So what are the ways to prevent mask skin problems? Not just acne, we can have some other contact dermatitis, irritant dermatitis and rashes that can itch on the face. So we'll be discussing on all those things in the next few minutes. So masks are definitely vital in reducing the spread of coronavirus, but they can also be harsh on your skin. So they can cause problems like acne, and they can cause some peeling of the skin. They can cause some rashes and itchiness. So to help prevent such skin problems under your under your mask, so we as a board certified dermatologist would recommend 9 tips. So as I go along, I'll be telling you the 9 tips. So the first would be cleansing and moisturizing your face every day. So gentle skin care can prevent a lot of skin problems. So when you're washing your face, use a mild fragrance-free cleanser. So it should be a soap-free one, no fragrance. And dry skin is also very common face mask skin problem. So applying a moisturizer adds a protective layer that can reduce dryness. So you want to apply the moisturizer immediately after washing your face. So to get the maximum benefit from a moisturizer, you need to use a moisturizer that suits your skin. First, you need to ascertain what type of skin you have, whether it's oily skin, normal skin, or a combination one, or a dry to very dry skin. So if it's an oily skin, you need to choose a gel-based moisturizer. Even if the climate is very hot and humid, that's when you need to choose a gel-based one. And if it's normal or a combination skin, go for a lotion based one. If it's dry to very dry, go for a cream based moisturizer. So, and the contents you need to look for is, it should be fragrance free, like I told you. It should be a mild cleanser, it shouldn't be harsh. So it needs to contain something called ceramides, hyaluronic acid and dimethicone. Dimethicone helps in creating a barrier and also reduces the irritated skin. So these are the contents you need to look out for. So you can prevent the breakouts if you have a moisturized skin also. And also it protects you from other irritation or the friction that can happen because of the mask. And if you have an acne and you have a tendency to break out, so still even then you need to use a gel based moisturizer. So it's important you use a moisturizer before and also after wearing the mask in order to prevent acne. So if you really have dry sensitive skin, it's much more important. So all type of people should apply a moisturizer before you wear a mask. So the second thing apart from the acne which is usually getting affected is the lips. So you need to protect your lips by applying a petroleum jelly. So dry and chapped lips are very common. So you can prevent it by applying a petroleum jelly after washing your face, before you put on the mask and before you go to bed. So, and also it's important you stay hydrated, have enough water, because of the mask also. Even I personally have not taken enough water while I was on the mask. So it's important. I'll be telling in the next few minutes how to take a break also. So after washing your face and before you go to bed, apply petroleum jelly only on the lips. Do not use petroleum jelly on the face. It can clog the pores again. It can cause breakout. So a moisturizer, like I told you, should contain certain contents. It should be non-comedogenic. It should be very light and oil free. So the third important point you need to do to prevent maskne is to skip the makeup. So whenever you're wearing a mask, try to skip makeup. But if you have to use a makeup, then you need to search for the products that are labeled as non-comedogenic or that won't clog the pores. And also the fourth point is avoiding new type of skin products. So since we are at home and it's a lockdown, a lot of people have been trying a lot of things staying at home, seeing in Insta and Facebook. So it's important when you are trying new harsh products, don't try them on the skin, because already you are wearing mask, you are adding much more irritation to your skin. So the contents which you better avoid would be retinoid or exfoliants that contain like glycolic acid. So all these are could be a harsh on the skin if you are trying for the first time. So, and also it's important if your occupation requires wearing a mask for a very prolonged time, it's important you don't try new skin products on your face directly. Try them on the other part of the body or the neck, and then you can try on the face. So, and also the fifth point would be using less of certain skin products if at all your face is becoming irritated. So even after irritation also, certain people continue doing the same thing which they have been doing, because they assume that it's not their creams that is causing the problem. Sometimes your pre-existing creams could have caused problem because you are adding on the mask, because mask is making the environment or the skin a little moist and making it little warm. That helps in extra effect of the existing skin products. So it's important you cut back on few products that can irritate your skin, like leave on salicylic acid or salicylic acid based face washes and retinoids and aftershave lotions. You need to be careful when you are using them. So please be suspicious of things which you already have been using. So this is also important. And then the sixth point would be wearing the right mask. So what exactly is the right mask? So what is important here is the skin is important, or is wearing the mask important? So I would obviously say you need to wear your mask, because we can treat acne but we do not yet have any medicine for COVID. It's always important to wear a mask, but you need to check few things if you are doing wrong. So a snug and a comfortable fit mask is very important. If it's very loose, it tends to irritate your skin because of the friction and the rubbing. So it needs to be a minimum 2 layers of fabric, and the innermost layer, the inside layer that rests against your skin, should be a soft fabric which is natural, breathable. So something like a cotton. So always the inside layer should be a soft, breathable fabric. The outside could be anything, and the inside is important. And also it should be something that will protect you from COVID, not simply any cloth mask, because right now we are in the double mask stage and it's so important we prevent any further waves happening. So The snugly fitting one, 2-layer fabric, and inner layer should be cotton. That should be the right mask. And if the mask feels really very tight, or it's very tight, or if it's very loose, both can irritate the skin. So you need to see if it's comfortably fitting you or not. Then so the 7th point would be, so a 15 minutes of mask break every 4 hours. This is what I was telling about. So many healthcare workers and frontline workers during the pandemic have found this to be helpful. And you need to remove the mask only when it's very safe to do so, and only after you wash your hands. So the safe places to remove your mask will be outdoors, which is very well ventilated, where you can stay at least 6 feet away from the people, and inside your car when you're alone, and at home. These are the places where you need to take a break from the mask every 4 hours. You need to take a 15 minutes of break. That also helps for your skin to breathe, and you also will get some fresh air. But please follow all these social distancing even when you are not wearing the mask, when you are taking the break from the mask. So the next important thing is, few people have been using the mask. There were some memes and jokes also coming, like coronavirus will just run away seeing the mask and the smell coming from the mask. It's very important that we change our mask frequently or wash it very frequently. So often people just carried away, every day they are using the same mask. We tend to forget the timeline, because we've been using masks since almost 1.5 years now. So it's important you make a note, and you need to wash every day if you are using a cloth mask, and see that it's not if you are using an N95, do not wash it. You just need to dispose it off. So it's important which type of mask you are using, and accordingly wash it. So washing it also removes the oil and the excess skin cells that are collected inside the mask, which could have led to the skin problems. So you can wash it in a washing machine or by a hand, and both ways the germs and other particles will be removed. But be sure that you follow the washing instructions that are for a particular mask. So you need to wash in hot water unless and until the instructions say otherwise, and use a fragrance-free hypoallergenic laundry detergent. It's important you don't use harsh detergents also. Again, they can, when you're wearing a mask, again you can get a irritation on the skin. So after washing your mask, it's important you check its shape. Again, if the mask is not fitting you after you washing it, then you need to dispose it off and shift to a new one. Okay. And the 9th one would be, most importantly, after following all these, if you're still having acne, please continue the treatment plan that your dermatologist is suggesting you, that they have created for you. So it's important, if you have acne or rosacea or any other dermatological problems, you kindly follow what your dermatologist is suggesting you, and stick to the treatment plan. This can keep the condition under control. Okay. So these are the 9 tips I wanted to share with you regarding Maskne. I would be happy to answer a few doubts and questions from you. So I'll just check the comments. So Mr. Bharat Vashisht is saying, my skin is oily, what should I do? So cleansing with I think I've covered all this. Cleansing, I'll just repeat for people who have joined lately. You need to cleanse twice daily, twice or thrice if it's oily. Use a gel-based moisturizer before and after usage of mask. And take a mask break every 4 hours, 15 minutes of break every 4 hours. So yeah. So any doubts, I'll be happy to answer. I guess everyone is well aware by this time. A lot of webinars, a lot of Facebook live sessions have happened. So I guess I covered everything. I'm happy to do this session. Thank you for this opportunity, Paulson's Derma. And if you have any doubts also, you can leave them. I'll be answering them offline also once I see the doubts. Okay, please take care everyone and stay safe. Take care.